Hello. So today we are going to discuss what are the tests which are required for runners. So running is something which many people like, and for obvious reasons, because running has got many benefits. It is helpful for losing weight. It is a good aerobic exercise. It is also helpful in controlling diabetes, high blood pressure, and it is known to reduce the risk of dementia, stroke, heart attacks, and even cancer. So with when running has got so many benefits, we see many people are interested in running, and why not? But there are always concerns because we see occasional people who just collapse while doing marathon, and they are apparently fit and healthy people, and those videos become viral and people just are scared and panicky. So that some people even hesitate to take up running because of those negative issues. But it is not all that, because those incidents are rare, and most often they are underlying heart problems or some abnormal diseases which are undiagnosed, and that is why it happens. So it is always better to remain safe and then do running in a good and healthy manner. So today I will just discuss what are the tests required before one takes up running, and they are all very simple tests. One is to check the blood pressure, make sure your BP is normal. Check the blood sugar, so fasting blood sugar, and something called as HbA1c, which gives the average sugar value for the previous 90 days. Lipid profile, which looks at the cholesterol levels, and then also check your vitamin B12 and vitamin D, because if they are deficient, then one can get early fatigue and more aches and pains. Same thing for hemoglobin, so get the hemoglobin checked, because if hemoglobin is less, one can get easily tired and fatigued. There's some specific heart tests, that is ECG, echocardiogram, and treadmill test. So these are done. So these are tests which I mentioned. They can be done once in a year if you are totally healthy. Now the specific test for the heart, like CT coronary angiogram or CT scan of the heart, they are not routinely needed. But if the doctor advises you based on the any abnormality in the other tests like ECG, echo, or treadmill tests, or based on your age or the family history, then these CT coronary angiogram may be done, but not routinely required. Now then the question comes, so these tests, if they are normal, you can take up running and continue running. There is no need to consult a doctor. But there are some situations when you should definitely consult a doctor. So suppose you are running, and when you run, during the run or post run, if you have symptoms like breathing difficulty, or you feel dizzy, or you have too much of heart palpitations, or you feel very fatigued, post run, you should feel fresh, energetic, and not too fatigued and tired that you have to take off from the work. And then, so if you have any episodes of blackout where you just faint for a few seconds, so if any of these symptoms happen during the run or post run, consult a physician, because evaluation is needed why this happened. In many times it could be just simple dehydration or electrolyte imbalance, but we should not miss an underlying cardiac disease which can get missed, and can lead to severe problems if it is undiagnosed. So I hope this was helpful for you, and I request you to watch this video, like this video, share it, and also post your comments and subscribe to my channel to watch similar educative videos in the future.